When you need medical help fast, use NHS 111 online to go from home to an urgent treatment centre
Mr. Williams, please come through.
or a pharmacy.
Hello, pharmacist will see you now.
Or if needed, stay where you are and get a call from a nurse, doctor or paramedic. Get assessed and directed to the right place for you in as little as 90 seconds. Use NHS 111 online.
This is the North East and North Cumbria Providers Podcast, highlighting the fantastic work taking place across the region to provide the highest quality of care.
Hello and welcome to another episode of the Providers Podcast. I'm your host Harry Newhouse, and on today's episode we're going to be talking about the development of the Portability Agreement. The Portability Agreement supports the effective temporary movement of staff between organisations across North East and North Cumbria, aiming to cut down the usual lengthy recruitment timelines and support operational service delivery. This is an agreement that all foundation trusts in the North East and North Cumbria have signed up to, and to discuss this with me, I am joined by Terry Phillips from the North East and North Cumbria Congenital Heart Disease Network and Julie Southern from County Durham and Darlington NHS Foundation Trust. Welcome to the podcast, Terry and Julie.
Thanks, Harry.
Terry, I'll start with you. Please can you tell us what your role is at the network and a bit of detail about your NHS career so far?
So I'm the network manager for congenital heart disease up in North East and North Cumbria. The network itself covers all 8 acute trusts across the region. And I've been in this post for 5 years. Prior to that I worked at GIRFT, which is the Getting It Right First Time programme, part of NHS England. And prior to that I was a programme manager for a health informatics company.
Brilliant. And same question to you, Julie.
Hi, yeah, I'm General Manager for County Durham and Darlington in Children's and Young People's Services. I've been in this post now for about 2 years, and prior to that I did service management with County Durham and Darlington. And the main role and priorities I have is service and operational management, which is working with the medical workforce for quality audits and quality improvements and the demand and capacity for our services.
Brilliant. And we're here today to talk about the Portability Agreement. As mentioned earlier, this agreement enables the temporary movement of staff between foundation trusts in the North East and North Cumbria. Could you talk us through how you two have used the Portability Agreement to share your approach and best practice?
As a network, we work with clinical teams across the region, looking after patients from childhood to adulthood. And for the Portability Agreement in this instance, there was a need at County Durham to have some clinical input from outside of the trust. Across the region we have paediatricians with expertise in cardiology who had capacity to help County Durham, and we approached them. And the Portability Agreement was fundamental to be able to allow them to come and see patients here in Durham.
Why was there need for you to use the Portability Agreement?
So within County Durham and Darlington we had a workforce gap of a consultant that had specialist interest in cardiology services. So working with Terry and the network, we looked to see what skills were in the region and see if we could utilise and work in partnership with some of our neighbouring trusts and their cardiologist consultants.
How did this benefit you and your departments and networks?
I think it was great for the network. It really brought together the paediatricians and to share information, also share their experience. It was good to be able to provide that support to reduce the waiting list and really to address issues with patient care.
So the benefits for County Durham and Darlington, where we obviously were experienced quite long waiting lists for our patients at that point, and these are children and young people, a very young age group, and it's really important that they get the right care at the right time. So working with our consultants from neighbouring trusts, we were able to expedite and significantly improve the waiting lists that we had, and then for any priority cases they were then referred directly.
Yeah, so there was a referral system set up, a referral email system that paediatricians and consultants at Durham referred patients to. This was triaged by the consultants at the Freeman, and then they identified a number of patients that could be seen locally by a paediatrician with expertise in cardiology, and it's these patients that were then seen by those in neighbouring trusts to Durham.
And what resources were saved by using the Portability Agreement?
I think It was really the best use of available resources within the region, and I think the portability agreement really does come to its own in this type of situation when you have a capacity in other trusts and being able to provide that mutual aid to trusts when they need it, and addressing those patient safety issues should they arise through challenges with workforce issues.
What difference has using the portability agreement made to you compared to how it was before?
I think it was easier overall to be able to move consultants around between trusts. I think prior to that, needing to have honorary contracts in place was quite time consuming, and also a lot of paperwork and a lot of additional effort having to gone into creating that. I think the portability agreement does help facilitate that between trusts.
And I think the only difference was it was quite a seamless transition, and it prevented any delays in the system which we would have had before if we had used the honorary contracts, which is what we used to have to do. So it was that quite a seamless transition, and it meant that the consultants could come in to support the patients, again in a timely fashion, if you like.
So were there any challenges that you came across, or anything that could have gone better using the portability agreement?
I think one of the biggest challenges was really the awareness that the portability agreement was in place. I understand that at senior levels within trusts that agreement's been signed and implemented, but I think that information and that agreement being filtered down to operational level hasn't quite happened yet, and I think raising that awareness would certainly put teams at ease that this is something that has been agreed across the region and is as good as using an honorary contract.
Through your experience, how do you think would be best to go about that?
I think things like this, and also through the provider collaborative and just that engagement at business managers levels, I think it's something again that maybe HR teams within trusts can filter down as well. There seemed to be more understanding between the HR teams about the agreement than there was from a service manager's perspective. And I think maybe there's some raising awareness to be done maybe within the HR teams.
I think also the finance teams as well, because you can hit the complication about how the consultants are paid for doing the additional consultant. The clinics on top of their current job plans that the contractors do with their own trusts. So there potentially is a little bit more work to do with finance colleagues and maybe some wider learning with HR colleagues to provide that additional support for service managers, general managers, who are trying to operationalise the need for the consultant workforce.
And I think that's possibly something that we could do after this as well, is just outline the process that we kind of created on the fly to engage with those finance and just the practicalities of reimbursement and that type of thing between trusts as well might be useful to record.
What feedback have you received by peers, trust colleagues and those clinicians that have benefited from helping your trust via the portability agreement route?
I think Durham were quite happy that we were able to fill the clinic time. We had monthly clinics set up prior to this anyway that were going to kind of go to waste, for want of a better phrase. So that was good that we could utilise those, and also I think the ease of which we could engage with the neighbouring trusts and those clinicians, and they were quite satisfied that the required governance was in place in order to be able to come and see patients in Durham. Also, I think to commend Durham as well, I think it was quite easy to access the IT. I think that process worked quite well. That was set up. Visiting consultants were able to access local patient records. They had Wi-Fi access and all of that type of thing was sorted out. There was training set up, so that went quite well as well. So that was quite seamless.
I do agree. I think it's to commend the admin team that's behind the front-facing services. So everybody pulled together to ensure that the clinics were set up, the communication between the consultants, the visiting consultants that were coming in to provide the services for the patients. So all in all, it was about good teamwork and having that information there and ensuring, including our outpatient nurse and their teams, to welcome the consultants in and obviously show them where they needed to go. So it was a good all-round workforce really behind the scenes that supported the portability agreements and how well they could work and did work.
How has using the portability agreement impacted patient care?
I think Julie will probably add a little bit more to this, but I think it has significantly reduced the waiting time and the waiting list for Durham, and you've recently appointed a paediatrician with expertise in cardiology yourself, who's coming to post in November, and that's enabled her to come in to join the trust at a time where she's got a manageable caseload and there's not too much pressure and challenge going into already challenging winter as it is.
And I think the other side with the portability agreement has demonstrated that the region has come together to look at the pathways, the regional pathways for cardiology and the patients. So actually it's brought the expertise together round the table to actually have a look at the pathways, and probably we've done some service improvement, quality improvements for those pathways, and the triaging of patients, because not all patients require a cardiology appointment because they do present with other symptoms as well. So actually it's enabled that intelligence to go on behind the scenes as well to review the full pathway.
Yeah, it's enabled us to bring the paediatricians together, because at the moment we have paediatricians with expertise kind of on their own in some respects dotted across the region, and it's given us an opportunity to bring them together to think about, as Julie said, what the referral pathways are like, sharing their own experiences within their local teams and being able to work as a collective than previously.
And plus, moving forward, as Terry's mentioned, we have recruited our own paediatrician consultant with specialist interest in cardiology, and they will be supported within clinics moving forward. But again, they will visit each other because Newcastle obviously is recognised as the local regional expert for cardiology. So it means that you've got that peer support moving forward, as that can only be a good thing, to ensure that we've got the right intelligent and the professional development.
Yes, exactly, and it's that mentorship and that sharing experience. And I think when you've got especially a paediatrician who's coming from out of region, who's new to the region, that just gives them that kind of peer support that they might need. So this has again been a springboard for that, which has been.
And we've done that gradual peer support prior to them coming into post. They've obviously, they've met their colleagues, they've worked with them. We've done some shared meetings with them, so it is a really positive for that peer support and moving forward.
Over the last year or so, the North East and North Cumbria have had probably one of the best waiting times in the whole country. Would you say the Portability Agreement has had a vital role to the success of that?
I would agree, yeah. Particularly in this instance, I think it's been, when I've been doing our own annual report actually just this year, one of the things we've reflected on is the success of this actually, so definitely.
Yeah, it's greatly reduced the waiting list for those young patients that need to be reviewed, and I think collectively within the region, everybody has worked together to look at their own waiting lists, but work together as a team. So it's definitely reduced, and it's been a positive step really to review the demand and capacity as a whole. I think it'll allow other neighbouring trusts and County Durham and Darlington as part of that to review any services that are vulnerable as well, that have any standalone and do have a workforce risk, and it will just gain that expertise. And the other plus side, it will probably allow that opportunity, like we did with cardiology, to review the pathways regionally, so you have no potential stop gaps in the middle, and it'll be a seamless transition and pathway and triage for patients.
That's it. It sparks that kind of collaborative working going forward. And also one thing we're hoping to do next year is to broaden that out to other workforce groups, to look at our physiologists across the region and bring them together in a similar way, because again, we have pockets with varying different skills across the region, and I think there's definitely opportunity to utilise the Portability Agreement to be able to move that workforce around alongside some of the nursing workforce, to be able to just cement those networks just for best care for patients with congenital heart disease.
Ultimately, would you recommend the Portability Agreement to other regions in the country and for other foundation trusts to implement?
Absolutely. As a network manager, I meet with the other congenital heart disease network managers from across the country, and that's something that I've mentioned to them. And again, when you look at it across the country, it's quite variable as to how it's been implemented. Everyone's at very different stages when it comes to provide a collaborative setup, etc. So it's something that people have asked us about and how we've done. And I think that in itself has been beneficial to us as a region. When you look at other parts of the country that's still kind of siloed in the way that they're working, I think they're provided collaborative and if things like this kind of bring people together easier.
And as a provider, I would definitely recommend it. It has been good to work with the network, and Terry has been very supportive to ensure we've got that engagement from neighbouring trusts. And you know, overall it's for the benefits of the patients and the safe care that they should receive and experience to their families as well. So yeah, definitely would recommend.
Brilliant. That brings us to the end of this episode of Providers Podcast. Thank you, Terry and Julie, for talking us through your experience of the Portability Agreement. We hope to be able to show more examples of how the Portability Agreement is used in best practice, so keep an eye out. Thanks for listening.
Thanks, Harry.
Thank you.
Thanks for joining us for this episode of the Providers Podcast. Hit subscribe to keep up to date with the latest news and catch up with what we've been up to on our website and social media pages.